Dr. Crutchfield is a board-certified emergency physician with 25 years of practical experience. He has particular interest in metabolic health, wellness, and aging. Don't we all have more of an interest in aging as we age? He's been accredited by the Society of Metabolic Health Practitioners and does telehealth consultations in Arizona, Nevada, and South Dakota. Today, he's going to be tag teaming with Dr. Brian Lenzkes. Dr. Lenzkes is a board-certified internal medicine physician with over 20 years of practical experience. You might recognize his name if you listen to one of two podcasts. The first is Low Carb MD. That was kind of the original low carb podcast. You guys were ahead of the game on that. It's one that I recommend to my clients all the time. He also is the host of a podcast called Life's Best Medicine, which is a very inspiring podcast. I highly recommend. Listen to both of them. He's focused on metabolic health, diabetes management, and lifestyle medicine. He currently practices in both San Diego and Arizona. He transitioned his practice to Prescott, Arizona. We are so lucky to welcome him to our beautiful state, this talented doctor. To learn how you can have a more productive conversation with your doctor, here's some advice from Dr. Brian Lenzkes and Dr. David Crutchfield.
Thank you. I'm David Crutchfield, as the introduction stated, and I am an emergency physician. And you're probably asking, well, why is an emergency physician standing up here? We'll kind of get that later. We also have another emergency physician in the house who's also doing metabolic health, and you'll meet her later. So we're going to talk to you today about metabolic health and the metabolic health difference, and give you some tools, things that you can ask your own doctors about, or things to empower your own health. So let's
and the reason there's two of us is so now we have as many doctorates as Dr. Ben.
Yeah,
it took
exactly.
two of us to get to his level.
Good point. Absolutely. Just some disclosures. I am the website founder of lowcarb.com. I am a founding member of the Society of Metabolic Health Practitioners and became an accredited provider. I am a member of the Obesity Medicine Association. I am a health and wellness chair for the American Academy of Emergency Medicine, Aging Well in EM interest group, and I have no financial interest to disclose, no pharmaceuticals or anything like that.
I'm a general internal medicine doc, as we previously said, host of a couple podcasts, and I have no financial interest in pharma, which will be clear, hopefully, by the end of this talk. We go to the next one. And I have no conflict of interest other than my podcast. The production costs are sponsored by Keto Mojo and Health Code, two products that I love. But I don't take any money home from my podcast at all. And Low Carb MD is not sponsored at all because we didn't want to have any conflict of interest.
Okay, and a disclaimer, we have to say this is medical information only and should not be construed as personalized medical advice. Please discuss with your doctor or healthcare provider before instituting any changes. So let's we got the legal stuff out of the way. We're going to start off on a bummer. Any of you ever been in the military? Yeah, good. Thank you for your service. I was Air Force Reserve for 3 years, and as we all know, in basic training, they just tear you down, and then as the course of your training, they build you back up. So that's what we're going to do here in this talk. We're going to start off with a bummer, and then we're going to build it up and give you some hope going forward. So here's leading causes of death in 2020. If you look at those, cardiovascular disease, cancer, stroke, Alzheimer's, diabetes. This is what most people are dying from. Now, when I originally made this slide, 5 of the 8 leading causes there are all linked to something called metabolic syndrome. And the hallmark of metabolic syndrome is insulin resistance, and that's what we're going to be focusing on today. And actually, I put an asterisk there on this slide because now if you have chronic lower respiratory tract disease, COPD, for example, you're twice as likely, according to some studies, to have metabolic syndrome.
So what is metabolic syndrome? As Ben already talked about, we have 5 criteria that we look at. He had already mentioned the high triglycerides. So if you have 3 out of these 5, it makes the diagnosis. We can kind of flip through all those. Bigger waist circumference, which correlates with visceral fat, the fat that's around the organs, rather than the love handle fat that doesn't cause these kind of cardiovascular disease. Actually, it's protective, believe it or not. So that's some good news about that. High blood pressure, which we'll talk a little bit more about, and elevated fasting blood sugars. And a low HDL, as Ben has already stolen our thunder and pointed out. So this study was one that convinced me as a doc to really start looking more into this. Because what else besides LDL levels, which we all talk about with statin drugs, predicts outcomes? So this is a study from the country of Colombia. They took everyone who had a heart attack, and they were trying to figure out, okay, how do we prevent heart attacks? What can we look at from a lab or vital sign perspective to predict who's going to have a heart attack and who's not? Now, if you see the risk ratio here is, if it's 1, it means it made no difference at all. Whether it was high or low, you couldn't use that as a predictor. So as we flip through these, total cholesterol made no difference in cardiovascular outcomes in these patients. High LDL made no difference. So you couldn't say their LDL was high, so they had a heart attack. It did not show up in this data. High blood pressure doubled the risk of heart attack and stroke. High insulin was almost a 700% increase risk. So I saw this first presented by Ivor Cummins, and I thought, you know, I'm the doctor, and if I don't put someone on a statin, they have a heart attack, I'm the one who's going to be in court because everyone thinks that's the factor. But the truth in this study was it made no difference. But high insulin made a huge difference, and high blood pressure. Guess what? 90% of the time, high blood pressure is associated with high insulin levels. So why is it that we throw a statin on all of our patients, and a lot of us in the room are taking it, and not look at insulin? Most people have never had a fasting insulin checked. It's because high insulin is lifestyle. We can only fix it through exercise, watching our stress, getting sleep, laughing more, having fun. And so that's a really, really important point of this. And again, besides LDL, what makes the biggest risk for cardiovascular disease? As you can see, as you go from left to right on these 2 graphs, men are on the left side, women on the right side. You can see the biggest increase, if that A1C 3-month sugar average goes at 7, right now the ADA's recommended goal for sugar control is at 7. How can that possibly be? It's because the Accord trial came out, and they showed the tighter you controlled sugars on diabetics, the more cardiovascular risk, all-cause mortality, heart attacks, strokes, everything got worse. Why? They were using insulin to control the sugars and not lifestyle. So we're arguing if we control it with lifestyle, we can decrease cardiovascular risk dramatically.
So some sobering statistics. Allison mentioned in the introduction about 88%, it's probably more like 93% right now, according to the latest updates. But sobering statistics here, in that 2/3 or more of the United States population are insulin resistant, pre-diabetic, or frankly diabetic, and this is an epidemic. And again, 60% of the U.S. population are obese or overweight.
And this slide it's really important. This is from Ben Bikman, as Dr. Ben talked about. Ben Bikman is one of the leading experts in fat metabolism and longevity. So this yellow line here that you can see is glucose levels. So we could be, if we're just following your glucose and 3-month sugar average, you can see it's flat for a long time. And if we click again, this is what insulin's doing at the same time. So when he's talking about insulin resistance, this is your pancreas making a ton of insulin. So it can keep making more and more insulin for a long time, but you'll see at the top of that green line there, at some point it can't keep up anymore. And if you keep eating sugar, what it does, and this insulin resistance is 10 years before we get type 2 diabetes. So we don't just wake up one day with type 2 diabetes, there's a progression. So what we do is follow insulin levels. If we see it going up every year, we say there's a problem. That means if you can think about it as a storage unit, if you have a ton of storage units, you can keep buying stuff and throwing it in there, it's not a problem. But once it fills up, now what do you do with the stuff you buy? You have to stop buying, which would mean stop eating sugar, cut back on sugar. If you're exercising like what Ben's talking about, you're burning out some of the stuff that you have in the storage unit. You're basically selling off some of your stuff. Now you can put more stuff in there again. But once it's full, this insulin goes higher and higher. It's trying to shove, really what it's trying to do is shove sugar into cells that are already full. So the cells are trying to help you. They say, look, I can't take any more sugar. So what happens? You shoot insulin and you shove more and more in there, right? And that's what becomes this issue. And that's why the all-cause mortality went up with using more insulin. Sure, the blood sugar looks better, but where's it going? It's not disappearing. It's shoved into your tissues, into your brain, heart, lungs, everywhere else. Kidneys for sure, kidney failure. So type 2 diabetes doesn't just happen. We can predict it. And in the last 5 years, I've not had one patient that we couldn't say, if you don't change, you're going to get diabetes, right? We can prevent it before it happens rather than trying to wait till it happens and try to fix it. And this again is from Ben Bickman's book, Outstanding, and he shows that insulin resistance, high insulin, is causally related to all these diseases that we're talking about. And he was being politically correct maybe, but depression, anxiety, all these other things, we're seeing more studies have come out since his book was written to show, yeah, for sure that these things are causally related, not associated. Like Ben was saying, if you're wearing red shoes and you have cancer, the red shoes didn't cause it, they're just associated. This is causally related. And so what we're doing in medicine is we're throwing a pill. Here's a pill for your fatty liver disease. Here's one for your polycystic ovaries. Here's one for your erectile dysfunction. Here's one for your high blood pressure. Instead of saying, and depression and insomnia. But if we fix the insulin problem, that fixes all these without another drug.
All right then, so now we've motivated you. You want to get healthy and learn this stuff. And this is the kind of things that you'll be getting from a metabolic health practitioner as opposed to traditional medicine. And I don't want to denigrate, our colleagues. Everybody goes into medicine because they want to do good for people and make a good living. I mean, let's face it. But I think the way things are organized now with many health systems and corporate practice of medicine, and you have 15 minutes per patient, and that includes your education, your diagnosis, and your charting, and you have 40 of them to do all day. It makes it very difficult. So, meet Marge. We had a parrot joke in the first talk, so perfect segue. Thank you, Dr. Ben. Marge is an eclectus parrot. It's one of the few species of parrots you can actually tell them apart, males from females, because of the color. You can see her cage-mate Homer in the background. He's green. Marge is red and blue. What happened there? So this is sad Marge. So we got Marge in 1998. I subsequently found out these guys will live like 70 years. So she's in the succession plan. But this is sad Marge. She began falling off her perch. She was injuring herself. She was having some labored breathing. And we were trying to figure this out. So I took her to an avian vet. Believe me, they're not easy to find, but there's some very good ones here in the Phoenix area. And we had thousands of dollars worth of tests, chest x-rays, ultrasounds, blood work. Well, eventually we found out that Marge had bird fatty liver. Marge had some congestive failure, fluid on the lungs, and such. So why was Marge SAD, and why am I using that acronym SAD? Well, SAD stands for the Standard American Diet, also known as the Western Diet. Now this picture here is some healthier stuff that I picked from, but certainly not what we were feeding Marge. How did Marge get so sick? Because the pasta we had for dinner the night before, Marge would get the next morning. The rice and beans from the Mexican restaurant, Marge loved those. She also liked a little wine here and there, but that fermented grape juice was her favorite. Didn't give her much of that. So all that stuff that we were eating was slowly poisoning her. And what I didn't realize at the time was it was doing it to me too.
So this is the question we'll pose. We'll have Doc fast forward through some of these. So what's better for you, having cereal for breakfast or oatmeal, right? So maybe go back just for a sec. Oh yeah. So the first one is oatmeal. So you can see the sugars went up, and that this is a continuous glucose monitor, so it's monitoring sugar 24/7. So you see it goes up, and then right at the end of that tail, you're going to see a little red mark there where the sugars actually went low. Why? The sugars from the oatmeal made the sugars go high, and the insulin shoots up to bring the sugars back down, but a lot of times it overshoots. So what we find is when people get hypoglycemia before lunch, it's because they're eating too much sugar at breakfast, and then they say, I got to eat more sugar, I got to snack before lunchtime because I'm getting low sugars. Well, the next one was cereal, and this last one was eggs. So we've been told, don't eat eggs. We're diabetics. What do? We're giving them sugar all the time, 6 times a day. And they go, well, your problem's having too much sugar and your storage units are full. You're going to shove more sugar in there? Eggs aren't giving you any sugar at all. So you can see this is the same patient with 3 different meals that they had. So this kind of, when we have these continuous glucose monitors, we can see real time what's happening with the patient. Sushi or steak, what's healthier? So if you're diabetic, that's what sushi does. Why? Because we have rice vinegar with some sugar in it and rice. Goes to 200, same person, they had a steak. No change in sugars. Why? There's no sugar in the steak. So if sugar's your problem, it doesn't make sense to be giving you sugar over and over. In the hospital, what we do is we put people in the hospital, then we put them on a sliding scale insulin and give them sugar all day. And as soon as they eat their oatmeal with orange juice for breakfast, their sugars go crazy. It's non-fat. So they're putting them on a non-fat diet. But the problem is fat's not what's causing the sugar spikes. It's the sugar that is.
All right, so we could go all day about nutrition, but we don't have all day. Things like prioritizing protein, how much protein is enough. But what happens if, all right, I still like my oatmeal. I'm not giving up my oatmeal. I'm not giving up that bagel that I love in the morning. I don't want to make those changes yet. And that's fine. Everybody has a right to make their own decisions using the information that they have. So there's another option. And when to eat may be just as important as what to eat. So fasting. If you're unwilling to change your diet, can you at least maybe slow down, give your pancreas a rest? And this is something that we as humans have been doing for millennia. There's feast and famine. Dr. Ben mentioned the growth and repair cycles, that anabolism, which is building up, building tissue, building muscle, repairing cells, building new skin, and then catabolism, which is the breakdown of products. What fasting does, the term these days is time-restricted feeding or time-restricted eating. We usually recommend 16 hours, 14 to 16 hours of just time-restricted fasting or eating for people. And the reason for that is, if you have your insulin rise within a shorter period of time, you give that insulin a chance to lower, and that allows your body to start oxidizing the glycogen stores and the fat stores, and you will lower insulin this way.
Yeah, and it sounds radical, the fasting thing, but if you think about it, you're sleeping 8 hours out of that. So if you eat your dinner earlier, like at 6 o'clock, right, and you go to bed at 10, that's 4 hours you fasted. You sleep 8 hours from there, and then you fast 4 hours in the morning. So that turns into a 16 or 18 or 20-hour fast very quickly. So you don't have to sit there and struggle all day, and especially once you get your insulin lower, it allows you to go longer without eating.
At some point during your fast, about 12 to 16 hours, you start getting into the liver's glycogen stores, so you're actually, getting rid of some of that stored glucose. And there's something called autophagy, which is a cellular cleanup process to repair a repair mechanism that starts kicking in somewhere towards 18 hours. Now, some people can't tolerate longer fasts, and I certainly, if you have a lot of weight to lose, that may be a very good tool for you, but if you can just keep it to, that 14 to 16 hour window every day, you'll be doing yourself some good. It lowers insulin and allows for the ketone production as well, which can also be used as a fuel. We're not going to deal too much with exercise because you had somebody far more expert on it, but it's certainly important for metabolic health, and this is something that your metabolic health practitioner should be stressing with you.
And for a long time, a lot of people in the low carb community said, exercise doesn't matter, just stop eating sugar and you lose weight. Well, yes, you lose weight, but the most important thing is maintaining muscle mass, as Dr. Ben said. You don't want to lose muscle mass, and your body has a choice, right? So you eat a cookie today. If you just worked out, your body says, oh, the muscles just burned a bunch of sugar, I'll just shove it over there. It's very easy. You need no insulin to do that. If you don't exercise, your body says, uh-oh, I got to shove this into the fat cell. So people with diabetes, their sugars stay up for a long time. Someone who's metabolically healthy can eat the same exact thing, and it goes up and comes right back down because their storage units aren't full. They have a place to put it. So once you run out of storage units, that's when we start getting into diabetes problems.
As you can see, exercise is metabolic health. It's also mental health, mitochondrial health, and mitochondrial health is metabolic health. Mitochondria, for those who forgot their biology 102 from high school, the mitochondria are little organelles within all of our cells, except for the red blood cells and some of the, the reproductive cells. But those mitochondria are considered, they used to be called the powerhouse of the cell. We now know that they do much more than that. And this is where they can metabolize and oxidize fats, glucose, and everything to keep you running.
And you're going to find a lot more evidence coming out now with mental health, with schizophrenia, bipolar disorder, depression, anxiety, are all coming back to mitochondrial health.
Do you remember that first slide with the leading causes, all related to metabolic syndrome? All of those, including cancer, all of them have impaired energy metabolism, which starts in the mitochondria as a hallmark. So exercise is healthy stress. We need healthy stress. Favorable adaptations occur. You get some hormone signaling that are released from the muscles, and that hormone signaling tells the brain to clean up its act and causes a counter release of other anti-inflammatory markers, and that helps you build and get healthier. And again, Dr. Ben mentioned that if you're in top of the strength, you have a much better chance of living much longer. So, and again, we're not giving you a primer on muscle physiology, but there's two types of actually there's many more types. The two subcategories that most people refer to are the fast twitch fibers and slow twitch fibers. The slow twitch fibers, these are the ones that I'm using right now as I'm walking around, standing up. I can do that all day. The fast twitch fibers are the ones that you need to really, you need to get the car off somebody. You need that burst of strength, and that's what high intensity helps train. That's what resistance helps train and maintain. And it goes, believe me, it goes downhill from age 40. but you can arrest it. You can stop it. You can actually build muscle. There was a study of 75-year-old women who were able to put on muscle just working out in their chairs. And so don't overthink it. This recent study finds that any amount of weightlifting, resistance training, moving heavy things helps.
And the best exercise is what you'll do, right? If you enjoy going for a walk in the park, go do that. If you like stepping up and down stairs, go do that. Whatever you enjoy doing. If you hate doing it, you're not going to do it for very long. So it's really about those sustained, as Kristen's going to talk about, these sustained lifestyle changes. I have an ER doc friend of mine. He works out 1 minute an hour. He sets his alarm every hour. He does 1 minute of push-ups. An hour later, does 1 minute of sit-ups, and he's in super great shape. And he doesn't go there, but he surfs and he does other things that he enjoys. So just adding those couple minutes in here and there makes a massive difference.
So when you go to your doctor, the top set is probably what you're going to get. This is what most insurance companies on your annual wellness visit will usually cover. And it's a CBC, a blood count, a complete metabolic panel, a fasting lipids, which is commonly known as your cholesterol test, may or may not get a hemoglobin A1C, but mostly they just want to look in the chem panel at your fasting glucose, which, as Dr. Lenzkes said, it's going to be normal right until the end in many cases. You're not, but if you measure the insulin, you're going to see that we have a big problem here. So these are basic labs, and they're going to give you basic insights. So the metabolic labs, much different.
Yeah, and the metabolic labs, I'd say the most important is knowing what your insulin level is. Because it could be low, it could be high. Either way, the lifestyle changes, they affect you the same way. Some people just don't make enough insulin, so they get diabetes. Some people have massive amounts of insulin, but it doesn't work anymore because the cells are turning it off. So that's a critically important one. And I would also say along those lines, all these labs we're talking about, vitamin D level, B12, subtypes of lipids. But we can generally tell, like Dr. Ben astutely pointed out, if your triglycerides are high and your HDL is low, you're in metabolic problem. Like, we don't have to see the insulin necessarily in that case, but also a coronary calcium score to see if there's actual disease. It's a CAT scan that takes about 10 seconds. And we can look at your coronary vessels and see if there's calcium deposits looking for plaques and damage. So there's new studies that have just recently come out with young athletes who have LDL cholesterols in the 700 range. The initial studies are showing, because their insulin's low, their triglycerides are low, their HDL's excellent, they're not showing cardiovascular disease. So a lot of these poor guys are thrown on statin drugs right away because they say, oh my gosh, LDL, which the other studies showed it made no difference, but we're scared about it still. Because it depends what setting you're in. So LDL in the setting of a diabetic with high insulin, high sugars is disastrous. In a young athlete who's super fit, the data is showing that it's not disastrous. So the biggest correlation with high LDL cholesterol, which with the recent meta-analysis that just came out, which is a study of all the other studies, the biggest correlation was low body mass index. So the skinnier you were, the higher your LDL went up, right? So it's the opposite of what we've been telling people for years.
A metabolic health practitioner may have you use a continuous glucose monitor, which is problematic for insurance companies because they're only approving it for type 1 diabetics and certain brittle type 2 diabetics, but it can give you so much information. For example, the tracing on the left was doing one of Dr. Ben's high-intensity workouts. Spiked my blood sugar, and then it lowered my blood glucose for the rest of the day. The one on the right, I was standing up in a group of commanders at the Maricopa County Sheriff's Office giving a talk, and boom, look at that, spiked my glucose even higher than Dr. Ben's workout.
And that's universal. That's that cortisol effect he was talking about. We see those stress hormones. So being stressed all the time, trust me, we see people's sugars through the roof without eating because they're stress intense. So yeah, there's something about relaxation, exercise, and going out and enjoying nature. So what we didn't cover, because we only have so much time,
Sleep and stress, very important. Vitamin D, a third of us have been shown to have insufficient vitamin D levels, but yet the United States Preventative Task Force still doesn't recommend in screening vitamin D routinely. The microbiome and its role. Dr. Ben mentioned we have 37 trillion cells in the body. Well, there's probably almost as many visitors within our intestines and on our skins, and they live mostly in harmony with us, but there are times they can turn against us. We didn't cover caffeine. Short answer is good. Go have some coffee. Supplements, maybe. Yeah, ask. Cancer. We didn't talk about cancer risk with poor metabolic health, but there are 13 different cancers that are definitely associated with insulin resistance. Preventing cognitive decline. Many studies have shown exercise, for example, can help prevent cognitive decline. So thank you very much again. Questions?
Yeah, we'll do the question and answer at the end, but I just want to give a little plug to Hal Cranmer back here. Stand up, Hal, just for a second, right? We just did a podcast yesterday talking about this stuff, and you don't have to stand up the whole time. No, I'm just kidding. I'll have you come, but basically, one of his patients, one of his residents at a group home, came in, bent over, drooling, unable to interact with his wife. We did a podcast on Life's Best Medicine. There's a plug for that. It's worth listening to. It's going to come out in the next couple of weeks. But dramatic interview with his wife, saying he went from being a brilliant guy, huge builder, doing all this stuff, and within several months declined. And then she put him in a nursing home. He got worse and was bent over, drooling, could not interact. At the end of our podcast, he walks through the door, right? He walks through the door. He put him on a low carb, ketogenic diet. He's trying to get him into ketosis because the brain can run on ketones. So this isn't theoretical. This is real. To see this happening with real people that would have been dead by now, guaranteed, are now thriving and getting to go to his great-grandchild's baseball game, hopefully in the next couple of weeks, and things like that. So this is real, and this is stuff that we can intervene on earlier before it becomes at his stage and having to reverse the shift. So thank you.